Good afternoon. Welcome to another lovely week with me, 𝐿𝐴𝐻. Welcome to 𝐕𝐵𝐻 Academy Reading Live. How was your few days that I was not able to come in front of you, but my colleague did? Did you all enjoy? What all did you do? Tell me. How are our live sessions aiding you? Are you all getting better? Do you have any valuable feeds that you want us to take a look into? We are always open to your valuable feedbacks, because whatever that we are or we will be is from your valued feedbacks. Okay, so do not hesitate to post your comments. How are you all? Tell me, what all did you do for the past few days? I wouldn't say 2 days, isn't it? Generally I would say 2 days, but I would say a few days. Did you all practice well? I'm sure that there are few who have made to their big day, the exam. There are few students who have messaged saying that the exams went well. The exams was, what they were really looking forward for. Yes, so tell me, give me some insights on the aspect how you all did for the past few days. Abhirajan, good afternoon. 𝐿𝐴𝐻 𝐀𝐝, good afternoon. How am I? I'm doing excellent, 𝐿𝐴𝐻. How about you? Are you all preparing well? Are you improving? What are the insights that you have to give us to make sure that, to rectify? See, it's always, learning is a process where you'll make some mistakes, you have to rectify again. Of course, it does come, and you are our absolute patrons. Sabita Prasad, good afternoon. Rajeshwari Vivek, good afternoon. Rama Devi, good afternoon. Very, very nice to see. Few new names, few no names. Lima Thomas, good afternoon. Tell me, how was your weekend? What were you all up to? Preparing for exam? Good, 𝐿𝐴𝐻, very good. Happy to hear that. Hope your preparation is, progressive, coming up. Good enough. And how about others? Tell me. You are all lovely enough to ask us how are we and what are we up to and all. Excellent. May 4th exam. I'm sure that is your day where you'll have all those things, whatever that you have done so far, the whole preparation is where you're going to input it. And I'm sure that God will bless you to have a lovely exam and to make sure that on the result day, make sure that your dreams are becoming a reality. Kavita Balaji, good afternoon. And so nice to see at least one icon next to your name. If you have not yet clicked the like button, please do click the like button. If you have not yet clicked the follow button, please do click the follow button. If you have not yet clicked the subscribe button, please do click the subscribe button. And least, if you feel my classes are beneficial, please do not forget to click the share button. Please do share on your social media platform. 𝐿𝐴𝐻, thank you, sir. Pray for all. Of course, our prayers are the only thing that we have for each one of you. So do not worry, it's always there with you. Chinju Siju, good afternoon. Preeta, good afternoon. Annie 𝐿𝐴𝐻, enjoying a lovely life? Annie is one of our lovely students who have made to her dream, and in between she comes and says hi to me. It's a very much of an honor to have students like Annie and all. Annie, how are things in Ireland and all? Enjoying? Yes. Sandhya Naik, Karnataka, isn't it? Good afternoon. Very, very nice to see. As I've mentioned, it's always so much of, what can you say? It comes, the gratitude comes to each one of you, because you make us this possible, isn't it? No matter whatever that we are doing, if you are not there, there's no purpose behind it. And so you have been an absolute support to Neetu's family. So hats off to each one of you. What does Neetu's family offer to you? We do have training for a lot of linguistic exams. Okay, there are some exams which, if you are really looking for certain countries, yes, you have few options available. Jinsi Joshi, good afternoon. Anjana John Paul, good afternoon. Mridula, good afternoon. So yes, so nice to see at least one icon next to your name, as I mentioned. So it shows that whatever that we have been doing, you are all appreciating for it. Right, so as I mentioned, the exams, we only give training. We have regular batches, we have crash courses available. So if you want to have any insight about what are the things that can benefit you, you're always welcome to contact the number which is on the screen, 974-794-4374. If you have any doubts with regards to what options do you have, you're always welcome to contact. We will never contact you. Why I keep on emphasizing that is, please be aware you're attending an online platform. It's an online platform, isn't it? There are n number of fraudulent people right in front of you where they would be messaging you. See, please understand, we will never message you. We will not ask you to call this number, that number and all, except for that particular number which is there, which I just mentioned. Okay, we will never contact you, we will never message you. If you need anything, you may contact that number and then clarify it. If anybody contacts you, if anybody messages you, the only thing that I would tell you is report them and block them. That's how confident we are, because we do not do anything for advertising in here. Okay, we do not do anything to make sure that your money is gone. There are n number of money rippers in front of you who will contact you, come, I will give you that, I will give you this. We would not do. And we do not support such kind of people with no backbone. And why do we have, it's another question, isn't it? See, why do you have all these fraudulent people coming in our life? Okay, that's the simplest thing is, so they know that the students who are attending Neetu's family's live, they're here with a purpose and they want to ruin that. They try to ruin that, because for us, we always believe in the student's strength. We always believe in the strength that you have in you. It's not about doing any fraudulent way to clear the exam. We do not teach that. So please ensure that if anybody contacts you like that, the only thing that you can do is just to be safe, report them and block them. Clear? Lydia Mole, good afternoon. Christina Varghese, good afternoon. Yogeshwari, good afternoon. Alan Maria Jomon, good afternoon. How am I? I'm doing excellent, Alan. Thank you very much. I hope you are, and all of you are doing excellent. Asha Sebin, good afternoon. Angelina Moore, good afternoon. A very, very, very good afternoon. And as I've mentioned, this is an international classroom. So a very good morning and a very good afternoon and a very good evening to all of my lovely students. Okay, so happy to see, as I mentioned, a lot of known names and few new names. Is there anybody who's attending the live for the very first time? Adyamayittu live attendee. If so, please do let me know. Yes, I'm attending for the first time, and where you're from. If it is okay with you. It's not mandatory, but I would love to know where my students are from. That's all. Arul Lakshmi, good afternoon. Monica, good afternoon. Mangalore. So there are few students whom I remember the place because they have always told me the place. Lydia Mole, yes, okay, fair enough. May I know where you're from if it is okay. Sneha Ratish, good afternoon. Nice. So again I repeat, the only way that not to miss what Neetu's family gives you, see, we do post regularly grammar challenges, we do have, you ask for reading classes for more time, we have provided you different faces, we have provided you with listening classes, we have provided you with speaking classes, we have provided you with writing classes, and all these that comes in front of you in the very same page that you're watching or the very same channel that you're watching is a free access. Now why I told you that the importance of sharing, because sharing, we say it is as caring, isn't it? See, there are students who are still not aware that Neetu's family offers such kind of free classes for them. When you share, of course, in your community, in the friend circle, they might share, and which in turn will go and reach the needy. So that is the smallest thing that I would definitely ask all of you to do is, if you feel, yes, the classes are beneficial, please do not hesitate to share. Riyaz, yes, new, okay. May I know where you're from as well? Rekha Nair, good afternoon. Chinju, me first time attending from KSA. I do have a lot of students from Saudi. So Chinju again, adding on to my known students list from Saudi. Bijia Jo, good afternoon. Razia Sajid, good afternoon. So very, very nice. As I mentioned, known name. How was my weekend? My weekend is always excellent, isn't it? I make the most out of it. All right, thank you very much for asking, Monica. I hope your weekend was very much on the aspect of enjoyed, as well as I know that you're preparing for your exam. So, yeah. So, are you all ready for today's session? If so, give me a quick thumbs up. Let me see how many of you are eagerly waiting for today's session. Jinu Aneeb, good afternoon. You name? Right, so I have Chinju who have told me that attending for the first time from Saudi. Okay, and you have to always remember the students that is there right in front of me, okay, or right in front of you are from different parts of the world. We have people from different parts of India, Nepal, Sri Lanka, Maldives, Malta, Mauritius, Afghanistan, Pakistan, different parts of Middle East, different parts of Africa, Australia, New Zealand, UK, you have Ireland, Scotland, Italy, Canada, US, Malaysia, Singapore, Thailand, Indonesia, Philippines, you name the country, we have the students are all attending from there. I could see, lovely to see your response. Jismal Reddy, Alan Reddy, Angelina Reddy, Abhirajan Reddy, Lima Reddy, Kavita Reddy, Monica Reddy, Christina Reddy, Anu Lijo, I'm attending from first time from Abu Dhabi. Very nice. So I have Chinju from Saudi and I have Anu from Abu Dhabi. Good enough, good enough. Rekha Nair is ready, Chinju is ready, Binsi hi. So as you all said, you're ready. Now there are a few things that we have done on the aspect of to bring a bit of change. We have just avoided the timer and I will be the one who will be monitoring the time. And now you will have the material coming on the screen. As soon as the material comes, please do, I'll keep the timer and I will monitor. I want you to see how to manage time without even having a timer in front of you. So because you said you are ready, the material will be popping up on the screen and as soon as the material pops up, I will put the timer. Right, Preeta ready, Rama Devi ready, Rajeshwari ready, good enough, good enough. So just there you have the material and I'm going to keep the timer 2 minutes. Please do the material and then we'll discuss. And don't type the answers, just put a thumbs up once you are done. That's the end of your time, isn't it? Time just goes very quickly. It doesn't wait for anyone. But happy to hear. Rajeshwari, Asha Sijo, hi. Reha Vasapan was the first to say done. Aishwarya said done. Sandhya done. Jismol done. Kavita Balaji done. Good enough, good enough. Nice to see. Sinju from Saudi done. Abhirajan done. Good, good, good. Lima done. Fair enough, fair enough. Now you have all said done. Now I want you to tell me what is your answer and where you got that answer from. I want you to be very precise on the aspect. See, don't worry about whether it is right or not. I want you to tell me what is your answer and where you got that answer from. Biji done, Rajeshwari done, Rama Devi done, Monica Vegas done. Good enough, good enough. Do tell me what is the answer and where you got that answer from. That where. Abhirajan, I got C from the last line. Fair enough. So the first answer that I have is C from Abhirajan. Arul Lakshmi done. Christina done. Good enough, good enough. Now do tell me what is your answer and where you got that answer from. Binsi done. Good enough. Like your response. Reha says C last line. Okay, fair enough. Rekha done. Biji says C from the last part. Okay. Good enough. So most of you are saying it is C. And do not worry, I have not told, or nobody knows what is the answer as of now. Yeah. Kavita Balaji is saying C last line. Okay, fair enough. So all of the people who have told me is C, and all of you are saying at the very same place. Okay, fair enough. Anybody else who have any other answers or anywhere else that you have got the answer from? No. See, please understand the importance of commenting. Now, why commenting? See, you have to understand it's not a face-to-face, isn't it? We are doing an online class. And on an online class, you have to understand the way that you respond is the only way that we could gauge whether you have got it right or not. And you have to always remember, I am here for the purpose of making my rights appreciated or my wrongs corrected. Whether it is right or wrong, it is not a problem. If it is right, we'll appreciate you. If it is wrong, we'll correct you. Both ways, you are the one who's going to be benefited. You have to always remember that. See, do not think on the aspect, oh my God, if I tell the wrong answer, what will others think? Let others think whatever they want. They're of no use to us. They are not going to give us a single penny for us to reach the dream world. If you have to make your money, it is you who have to. If you have to save your money, it is you who have to. Because if you don't come up with what you have done, okay, you are not going to rectify those mistakes. If it is a mistake, I'm not saying it will be. See, there are times where 100% of my students went wrong. 100% of my students have got it right. 1% have got it right. 99 have got it right. 75, 25, everything is a possibility. So do not worry about it. Arul Lakshmi from last line, fair enough. Angelina A from middle para, very nice. I love those students. I got this from here. Right or wrong, let it be. Ipan ഞാൻ എല്ലാം correct ഉത്തരമേ പറയാനുള്ളൂന്നുണ്ടെങ്കിൽ do you need to sit in a class? No, you should have gone and written the exam, isn't it? That's how you should understand. You have to come up with an like a mentality saying that, see, I'm here attending a class is to make sure that one, if my answers are right, yes, be happy with it. If your answers are wrong, again be happy with it, because we are here to correct you. Fair enough. Asha Sijo is also saying A from middle part. So fair enough. I have now two people, Angelina and Asha. I always love those students who have the ability. I have got this. Lijo is saying A. Fair enough. Middle part. So people who have got C are from last, people who have got A are from middle. Fair enough. Manisha Sunil, good afternoon. Very nice to see a lot of known people as well. Reha, good afternoon, sir. After a long time, yes, I was just seeing you. Was always smiley face, reading task and explanation. Fair enough. That's another thing, isn't it? They always have a different phase when I take my classes and when I come for live. Then I'm sure that you know why the reason is, isn't it? So nice to see you as well after some time. I hope your preparation and all are going well. Clarina Fernandez, hi. Reshmi Bipen, good afternoon. Fair enough. Right, now let's go back to the material. Now the material will be coming up on the screen, and you have to always remember part B, the strategy is different, the number of questions are different, everything is different. So you have to know what is the right strategy and what you are expected to find in that particular thing. So part B will have 6 questions where it is multiple choice questions with 3 answer options. So the only way, the strategy to find the answers are called elimination method. So what is the strategy called? Elimination method. Now elimination method is very easy provided you practice along with it. So in order to do elimination, the first and the foremost important thing is you have to do 3 things when you're doing part B. 1, read the question. Very, very, very important. 2, as you read the question, underline the keywords. And keywords should not exceed more than 2 to 3 words. Okay? Keywords should be those words that is important. When you look at that word, you will understand the question. Those are called keywords, or the main idea behind the question. Okay? And the final thing is understand the question. Very, very, very important that you follow these 3 things. 𝐻𝐿 𝐉𝐮𝐧𝐞, good afternoon. Understood? Now, after doing this, you have 2 options. Students have the option of reading the answer option, underlining the keywords in the answer option, and then picking it up from the paragraph, which I do because I want to know what I'm searching for in the paragraph. But there are students who say, sir, I want to read my paragraph and then I can remember and I can easily find the answer. Either way, it is fine. Okay? But reading the question, underlining the keywords, and understanding the question is very, very, very important. Now, let's see. When are staff permitted to wear sports attire? So, when permitted sports attire. That's enough. Okay, maybe. See, this when is very important. These kind of WH questions, okay. We said WH questions are at most important. If you don't identify what these WH questions are, we say 1 husband and 5 wives. That's the 5 W's. How is the husband? Likewise, you will have to differentiate. Now, you have to read. So, when are staff permitted to wear sports attire? So, very specifically, the question is asking you, when can the staff wear sports attire? Staff, okay? Now, when? So, definitely it's for some particular time-related thing, isn't it? Some particular thing. So, is it as a standard that they can wear? So, as standard, or they can wear sports attire unless cautioned, or is it in special circumstances? So, very specific, isn't it? 3 different answer options have 3 different focus. 1, it's a standard. 2, unless they are cautioned, they can wear whenever they like. So, that is why unless caution means they have been told, okay, see, you have started wearing it, you are not supposed to. Until they are being warned, they can wear. Is that when it is? Or in special circumstances. So, definitely it is a memo about hospital attire. Attire means the way your dress up. The objective of our dress code is to ensure that staff maintains a positive professional image. So, why you have to maintain a dress code? Members of public should be able to easily recognize staff and identify staff roles and professions. That is why you can always relate it, isn't it? When you read, you have to picturize it. Okay, see, in my hospital, the janitor is having a different attire, the RN is having a different attire, the head nurse is having a different attire. Why is that? So, they know who are what. Okay. So, furthermore, it is important to ensure that staff wear clothing that ensure that infection control and health and safety is upheld in order to maintain staff and patient health and well-being. See, the purpose, why they have to have proper attire. This policy applies to all staff employed by the trust, including students who are on work experience or placement, as well as bank agency staff, trust volunteers. So, they are giving you a detail of who all should be looked into, or who are the people who have to follow this attire. Staff are permitted to wear their own clothing under the following circumstances. Now they are saying staffs are, so now the question is, when are staff wear? So, following code, personal, own clothing. So, it can be, isn't it? So, till now nothing has been mentioned. When employed in non-clinical duties, that means, okay, the staff is not doing a non-clinical duty, when no uniform is required for that particular role. Example, they're giving certain example, okay, managers or in clerical staff. See, clerical staff means the com staffs. Okay, they're not coming into the closer vicinity of any area where that is, or even managers. Clinical care staffs are allowed to wear their own clothes when they are attending meetings, either internally or externally. Okay, now if you are working in a clinical staff, you should wear your personal clothes only. They are giving an example also. Okay, now it's okay. Right. I'm just trying to remove it, it's not going. So, yeah, fair enough. Now, what are the other things that you have to really look for? Okay, sorry. Right, now it is down there. Reading. All staff must wear protective clothing when performing clinical or personal care duties. So they are saying this is the time where you should be wearing it. Okay. Now all staff are prohibited from wearing sports clothing. Now comes our question. So this is why you should know where the questions. You have to answer to the question. Our question is only about not what personal clothing. Yes, of course it is personal clothing, but when you should wear one particular attire. So sports clothing, unless, now comes the rule, isn't it? Unless engaged in activity where special sports clothing is required. So they are only supposed to wear sports attire only if it is needed. So it is very straight. The answer is C. Understood? As a standard, no. There is nowhere it is saying that they can use sports clothing as a standard. Only if that particular situation deemed appropriate in wearing sports attire. Okay, so in special circumstances only. 𝐿 is dancing. Good enough. Why not? Isn't it? You have to make the merry out of your achievement. Good enough. Reha Vasapan is dancing. Good enough. Good. So happy. I hope my explanation was fair enough. Did you all understand? If you have any doubts, you're always welcome to clarify. If not, put a thumbs up saying yes, understood. Kavita Balaji is happy. 𝐿𝐵 is happy. Good enough. Christina Varghese is happy. Good. 𝐿𝐶hin𝐲 is happy from Saudi. Good enough. So you're all okay. Do you have any? Monica Vegas is dancing. Do you have any other doubts with regards to that question? Rima Thomas is happy. See, and one thing that I always admire coming in front of you is you're all there, in the very same page that we all are. When you are being explained, when you are being instructed, when you are being, or when I give you explanation, you're all able to relate it. So which is an absolute stunner. Good, Ramadevi understood. Abhirajan clear. Good. So nice to know. So now we've done with part B. Okay, now which you all are waiting for. We've already shared in the Telegram pages that is there on the very same page that you're watching. So if you have not yet joined our Telegram page, please do join the Telegram page. We have 2 Telegram pages. One is an official �NITU's Academy Telegram page and an exclusive reading Telegram page. This exclusive reading Telegram page, you will be only accepted after a scrutinizing policy. Even though the Telegram pages and all are of free access, but this scrutinizing is to make sure that to avoid these fraudulent people. We try to do our level best. So we ask you to send certain details only after our admin checks, and then you will be accepted into the group. Angelina understood. Alina clear. Okay, fair enough. Now because you all said that you're clear, let's go and dig the part A. I'm going to fire the 20 answers, which I've already shared at the very same page that you're watching in the exclusive and all those social media platforms that which �NITU's Academy has. We have given the free access. There you have the material. So what is today's material? And the most important thing is how many minutes you took to complete it and how you felt about today's material. Do let me know how many minutes you took in order to complete this material. Do tell me. I'm eagerly waiting to see. Tell me. Very nice. I'm only getting the the timing now. 𝐿𝐶hin𝐲 12 minutes easy material, Sandhya 13 minutes easy material, Abhirajan very precise 10 minutes and 50 seconds, Angelina 12 minutes, Grishma 10 minutes, very good, Lima easy, Grishma 𝐷𝐿𝐴 good afternoon, Christina Varghese 13 minutes, okay, fair enough. Chinju 13 minutes, absolutely good enough, good. So 𝐿𝐴 13 minutes, very nice. I love the response as well. So it makes me more, to your pace, isn't it? You are commenting. So I have to also live it up to that pace, which makes me also more energetic. Fair enough. Kavita Balaji, as always, precise 10 minutes 51 seconds. Riva Rijo, good afternoon. Right. So I hope all of you have taken the printout. Please do take the printout. Please do write on the very same page that you've taken printout. Don't write in separate papers and all, which is unethical, because you're not gonna get such kind of liberty. You have to write in the very same space that is there. So you have to write, and practice makes a man perfect. The more you write in that given space, the more perfect you become. The handwriting, the spacing, the what can you say, the inclusion of writing all those answers in that given space. That's called practice. Fair enough. Now let's go and dig it in. So we're going to talk about part A. So part A, unlike part B, very different. Okay, part B I told you, elimination method, you have to understand certain gist about it. And the answer option will always be in a paraphrase form. Now here in part A, we are going to talk about 15 minutes, so one time barrier, where you are expected to tackle 20 questions. So that is something which is very, very important. Here the strategy is called skimming and scanning. Okay. Now scanning, you are very much aware of it. It's called detail looking. Skimming means quick look. They say 1 to 2 minutes, but I say with practice, with all due respect, with practice, you can take up to 15 seconds each text. That is more than enough to underline the keywords. So you'll have 4 texts based on one common theme. So today's common theme is kyphoplasty. Okay, so 4 texts, text A, text B, text C, text D, will be based on kyphoplasty, but it will be different to each other. You should know, as when you are underlining the keywords, you should differentiate. Okay, see, text A is about this, text B is about this, text C is about this, text. If you can do that, mark my words, it's just a piece of cake. No matter whatever the challenging material that can come, if you know what is the strategy, if you know what is the way to find, what is the purpose. See, it is, part A is about keyword referencing. It's absolutely that. And synonyms. They use a lot of synonyms. So what are the things that you have to do? Okay. So 20 questions, 15 minutes, skimming, scanning, all those big words are there, but very simple. So I'm just going to show you how to skim. See, skimming doesn't mean that you're going to read the words, each and every word, and pronounce it to the absolute perfection and all those things. You're going to quick read it just to understand the overall gist about it. And as you do that, you're going to underline the keywords. So what are the keywords which we have already mentioned? And if you're still not aware, we have given you a lot of tips and tricks in a very exclusive video which is there on the very same page. It dates back a bit. Go back and see which is the video which has the maximum number of views. That is the one. Okay, just the clue. Now, how to skim. So, kyphoplasty is a minimally invasive procedure to treat the compression fractures in your spine. They are also painful, break your vertebrae and make it on the spine. Compression fractures can cause an bone collapse, leading to kyphosis and hunched over and limited breathing and function of abdominal organs, the curve and happening of the vertebral movement. Most of the fractures, thinning and weakening of the bone, osteoporosis, and this is by treat pathological fractures and broken bone underlying condition. Spinal tumors and myelomas, and kyphoplasty, compression fractures, not in the herniation, arthritis, and stenosis. Done. So what did I understand from this? I have underlined for you, it's a minimally invasive procedure where spine, okay, osteoporosis is there, vertebrae is there, hunchback is there, then they're saying about a few other conditions which is causing there, and then they're saying it is used to treat the compression fractures. Likewise, you should underline it. Each text has its own purpose. On the day of surgery, so what do you mean during procedure? Done. So as when you're done. Now text C is talking about a study. So any question related to study, go to C. Now text D, talking about some complications or some issues, adverse effects. So anything which is related to after surgery. Yeah. So this is where those important things is. Once done, you're going to go to the question. So there are 20 questions, and these 20 questions are divided into 3 types. You should know the types of question, you should know the instructions of the question, you should know the numbers of the question. So 1 to 7, these are called match the following questions. 8 to 14, these are called short answer questions, and 15 to 20 are called fill in the blanks question. This is how the present structure is. You should know. So 1 to 7, match the following questions, where the instructions should be by hearted by you. You are expected to write any of these letters, A, B, C, D, and you may use any of these letters more than once. Okay. So here also strategy is underlining keywords and referring with the keywords. Purely keyword referencing. If your keywords are proper, you can easily find. See now where do you think? Impacts of prehistoric conditions in cohort. Cohort means a study. Where have they mentioned about study? See. Understood? See, this is how you differentiate. So cohort is a particular study where only one particular kind of disease condition, those kind of people are being taken into. That's why it's called a cohort. So where? So 196 patients have been taken. That is it. Understood? So, and then they are saying about prehistoric. So where are they saying? Patient with history of malignancy. So prehistoric, something which they have already had. So this is where you get the answer. You don't need to have the specific places, but this can be also looked into. Now see the next one. Clinical characteristics that define the optimal candidate of kyphoplasty. So what decides, okay, these people can be. So definitely I feel it is there in A. Why A? Because that's the place where they are saying to be a candidate for kyphoplasty. So that is where, okay, you must have these kind of problems. Done. An issue that seldom means what? Seldom means not often, isn't it? Cause complication post kyphoplasties. Now this word post, after. So, sorry, post means after. Okay. Now what are the complications that is going to happen? So where are they talking about all these things? Okay. So they are saying the question keywords are an issue that seldom cause complication post kyphoplasty. So what are those? So who have underwent kyphoplasty at large urban medical center. So they are saying about non-opioid, and they are saying with an opioid prescription following compression. So 11 without an opioid post. So all these things are prior diagnosed. This is where that word comes. So the answer is C. Understood? Now, the role of balloon-like apparatus utilized in the procedure. So in the procedure means during that, isn't it? So during procedure is mentioned only in D. Now, are they saying anything about a balloon and all? Yes, they are saying, isn't it? 1Z, trocar is in place, your surgeon will inflate the balloon-like device. So that is it. The answer is B. So for which medical conditions indicate as treatment modality? So they are very specifically asking you which condition this is. So where are they talking about these conditions and all? Definitely in A. Now see, kyphoplasty is a minimally invasive surgical procedure to treat the compression fractures in your spine. That's it. So the answer is A. Now, the venue where 196 patients undergo kypho. So definitely, D, isn't it? The study is in, C. The venue, C. Where is the venue? 196 patients underwent in Urban Academic Medical Center. That's it. So good enough. Now, why were a considerable number of patients excluded from the study? So excluded means what? Somebody has been avoided. So excluded is as such there. So these are the reasons. So definitely the answer should come from C. Understood? Good enough. Now, let's go to the next set of questions. So, next set of questions are called short answer questions, which starts from 8 to 14. So, 8 to 14 short answer questions. Now, what age range encompasses? Encompasses is a very beautiful word which means includes. Okay, who receive kyphoplasty in the urban. So, urban definitely go to C. Yes? Yes or no? Go to C. Now see, it is saying age range, age 50 to 85. And I think I made an answer wrong, okay? See, that is what I was a bit confused with when I was see, an issue, okay? So question number 3, an issue means it's a complication. So it should definitely come in D, because seldom cause post to. Now why that is? So it's saying bone cement leakage, sometimes the injected bone cement might involve vertebral compression clag, but it's rare, so seldom. Okay, any complication even when it occurs. So that is why the answer to question number 3 is D. Okay, I'm very sorry for that. Now, next question. What can be serious outcomes of misaligned instrument during surgery? So definitely it is asking you something about misaligned during the surgery. So something serious outcome. So that means definitely during surgery means it should have gone to where? B. But here they are saying the outcome misaligned instrument. So something which is there. So for example, paralysis could be the result from a malpositioned instrument during surgery. I'm sorry. So the answer is, what is the condition? Paralysis. P-A-R-A-L-Y-S-I-S is the answer. Now, question 10. Which medical implement is introduced percutaneously, so under the skin? You know these kind of things, but these are all medical terminologies, isn't it? And directed into afflicted vertebral body to execute kyphoplasty procedure. So where are they talking about all these? So now this time it is during procedure, isn't it? They are clearly saying under the skin. Subcutaneous means through the skin or under. So they are saying during kyphoplasty procedure, you lie on your stomach, your surgeon will insert a hollow needle called a trocar. So the answer is very straight, T-R-O-C-A-R. Good enough. I can see that most of you are writing the answers, which I appreciate, isn't it? That also shows that you are actively participating. Good enough. So what is the principal determinant? That means the prime factor, isn't it? What decides vertebral compression fractures stemming from the progressive attenuation and fragility of bone tissue? Now there are two words, isn't it? Very, very, very nice word. Progressive attenuation means thinning. Fragility of the bone tissue means weakening of the bones. So where are these words? So definitely in A, is it? Because there is a bracketed word. So the most common cause, that is where the keyword synonyms cause the fractures in this is the thinning and weakening of the bones. What is that condition called? Osteoporosis. O-S-T-E-O-P-O-R-O-S-I-S. Good enough. Now next question. Now see, what should be the estimated duration, so some time frame required for the completion of kyphoplasty procedure be less than? So during procedure, a kyphoplasty to less than an hour. So what is the duration? An hour. Less than is already given in the question. So if you write less than an hour, your answer is wrong. Okay? An hour is the answer. Good enough. So what underlying factor precipitate? So something that it initiate collapse of vertebral bone characterized by Spinal curvature, that means bending and all, resulting in the hunched appearance. So that means your posture will be hunched. So definitely A. Because that's a place where all these things are mentioned, isn't it? Compression fractures can cause the bone in your spine to collapse, leading to kyphosis. What is kyphosis? Or a curve in the spine that makes your hunched over. So very straight. The answer is two-word answer: compression fractures. COMPRESSIONFRACTURES. In what alternative anatomical location, so somewhere other than the normal, could the cement leakage occur beyond the nerve root, potentially eliciting exacerbated symptoms? So, alternative cement leakage where? Definitely D. So, cement leakage is mentioned somewhere in D? Yes, it is mentioned. So, what are the things? Where is the alternative place? Okay. So, they are asking you about alternative place. Where is it going to happen? So, they are saying, see, in some cases, either failed or relieved. For example, if the bone cement leaks onto your nerve root or the spinal cord. So, what is the answer? What is the alternative place? It is the spinal cord. You can write it spine. Just small. See, please understand. If you have written on the aspect of it's a typo, it's fine. But see, spinal cord spelling, SPINALCORD, cord, not code. There's a difference, If it's a typo, no problem. So spinal cord. With the article the is also fine. The spinal cord or spinal cord, anything is an okay answer. Now for the final set of questions, these are called fill in the blanks question, where the instruction remain very similar to that of short answer question, where the answer can be a word. Short phrase. Short phrase means anything between 2 to 3 words. You have to stipulate it. Now they have come up saying that short phrase means about 2 to 3 words, or it can be words. It can be a combination of numbers or a combo between word and number. So paralysis may develop due to either a misaligned surgical instrument due to the procedure or an excessive seepage. Seepage means something of leak, of dash onto spinal cord. So definitely somewhere in D only. So what are they saying? So see, for example, paralysis could be, so they are saying excessive leak onto spinal cord is there. So what is the other thing which is missing? Bone cement. It's again a 2-word answer. BONECEMENT. Question 16. Kyphoplasty offers a therapeutic avenue. Avenue means way, path, for addressing pathological features associated with. So they are very specifically saying about spinal tumors. So kyphoplasty definitely should be there in A. So spinal tumors is there. And what is the other one which is missing? Multiple myeloma. So MULTIPLE MYELOMA. Again a 2-word answer. The accurate placement of trocar. So when the word trocar comes where, this is how you should start. Trocar, I know that it is there in B. Now go and see. Trocar, facilitated through the utilization of dash, a specialized form of X-ray imaging. Imaging. Now you know that it is in D. So that's called skimming. Now I'm going to scan. So what are my keywords? My keywords are X-rays here. Yes. Affected spine, proper positioning guide. Trocar is here, proper positioning in there, called the fluoroscopy. FLUOROSCOPY. That's the answer. Understood what is skimming and scanning? Now, see again. Unlike other conditions like disc herniation, arthritis, stenosis, so somewhere, isn't it, where these kind of things are, we have done in previous question also. So, going into A. Kyphoplasty requires dash directly correlated with the compression fracture. Now, where are they talking about? So, I'm just going to change the ink so that you will know where all these words are. Now, what are they talking about? So, they're saying the key candidate must be compression fracture is there, not other conditions like disc herniation, arthritis, stenosis, candidate kyphoplasty, all must relate to, all those things are there. So what is the only thing which is missing? Pain, PAIN. Excellent, good enough. The penultimate question for today. In the event of bone cement infiltration, so that means bone cement entering into. So where is bone cement infiltration? For me, the very quick way is D. Now, there exists the potential embolic migration of the pulmonary vasculature precipitating arterial obstruction. So all these keywords which we have already done, we have already got used to these kind of words, isn't it? So where are they saying? Pulmonary embolism, yeah, bone cement get into the vertebral vein, potentially traveling to lung and cause arterial obstruction. All those things are there. So what is the only thing which is missing? Vertebral vein. Travel to the lung, it's there. Pulmonary is there, Preeta. So this is why synonyms. So lung is already there as pulmonary. So the only thing which is missing is vertebral vein. VERTEBRAL-VEIN. Because you have to see there is a article a here. So that's the clue. Understood? So don't avoid articles also. Okay? So vertebral vein. The ultimate question for today. Included in the ultimate analysis, 27 patients who were underwent kyphoplasty. So patient and all those things where? In C. So 27 is here. Opioid naive patient underwent kyphoplasty included final analysis. So the only thing which is missing is opioid naive. OPIOIDNAIVE. So I have fired my 20 answers. If you have any doubts with regards to any of those questions, please be kind enough to ask me, or else do shoot me what are your total scores. Very good, very good. Sandhya is saying opioid naive. I hope all of you have got all the answers, except for that 3, isn't it? I was also a bit, I'm very sorry for that. Okay. So apart from 3 that got you a bit confused. And see, as I've mentioned, see, I am a human being. I would also... Beulah, nice to hear you. From you, Beulah, good evening. I've cleared my exam with God's grace. I'm waiting for this tale to express my gratitude for Neethu's family. Thank you so much for your support. Beulah, it's an absolute honor to know that you have made to your dream country, isn't it? It is all because of your hard work. And one thing I would always appreciate when a student comes and says is, when the student says, he have made to my dream, it is an absolute booster to all my other students who's there in front of me, who will also start saying, I will also come and say, one day I'll come and announce in front of all that I have made to my dream. Beulah, if you would be kind enough to tell me what are your scores, it will also be a morale booster for all the other students. So congratulations, Beulah, on behalf of all of us from Neethu's family. An absolute honor to say that you are a proud student. Okay, we are so happy to be, in association with you. When you came to us, it's an honor because you all make us proud. So good enough, Beulah. Very, very, very good enough. Keep it up. Kavita 20, Abhirajan 20, Chinju, thank you. Jismol, congrats. Yes, Beulah, take all these congratulations from all of us from Neethu's family. Jismol is saying congrats. Christina is saying congrats. So this is what we are. We are a family. Okay, we all are. Beulah reading 360. Okay, fair enough. It makes me more proud, isn't it? When you score 350 and above, it makes me all proud, isn't it? It's all because of your hard work. Rama Devi, congratulations. Take, Beulah, this is your time. All of us from Neethu's family is congratulating you for your hard work and that, what can you say, that great achievement that you've done. Kavita is saying congrats. Arul Lakshmi is saying congrats. Angelina is saying congrats. So it's an absolute honor to know that, Beulah, you have made to your dream. I know that all those tough times that you had in your life, and this moment will make it all feel so light, isn't it? All those hard work that you've done, it's all for this particular moment. Kavita is saying thank you. Beulah is happy, and Beulah would always thank each one of you for your congratulations to her. So I could see that few of you said 20 out of 20, but others didn't. But I'm sure that it is all because of that, happiness to Beulah's result. So until and unless I see you all tomorrow, adios from me. God bless you all. Take care. Bye.